Hi, it's Dr. Chris Goebbels here from Square One, and in our blog this week, I'm talking about NSAIDs, non-steroidal anti-inflammatory drugs, and their effectiveness, or I should say lack of effectiveness, in treating chronic spine-related pain, back pain, neck pain, those, and some of the negative side effects or the harmful side effects of taking those. So, chronic low back pain is the #1 cause of disability. Chronic neck pain, I think, is the #4 cause of disability. And I think headaches, migraines is like the #6 cause of disability in the United States. So this is one of the most common things people are seeking medical treatment for. NSAIDs, non-steroidal anti-inflammatories, is the most common treatment prescribed or utilized for spine-related pain. Now, NSAIDs can be both over-the-counter or prescription. Some of the most common over-the-counter NSAIDs are things like ibuprofen, it could be aspirin, Motrin, things like that. Some of the most common prescription NSAIDs are things like Celebrex. So in the research articles I talked today, a couple of them were actually Cochrane reviews. And the interesting thing is they were comparing the effectiveness of taking NSAIDs versus placebo, which is basically like a sugar pill, or it's a fake treatment, which is basically doing nothing. And they actually talked about how the NSAIDs were barely more effective than taking the placebo. But the other thing is the NSAIDs had a lot of dangerous side effects. For example, in one of the other articles I talked about, over 100,000 people are hospitalized every single year from the negative side effects of taking NSAIDs. Probably the most common negative side effects is gastrointestinal problems, things like ulcers, internal bleeding, those kind of things. On average, every time someone's hospitalized for the negative side effects of NSAIDs, the average cost is between $1,800 and $8,500 per hospitalization. So we know that NSAIDs are basically 100% non-effective. There's considered no real-world benefit, and they have potential dangerous side effects. Now, you have to understand the most common cause of back pain is when the joints get locked up and don't move. We call those subluxations, you can call them fixations, I don't care what you call them, but when the joints get locked up and they don't move, they fire what's known as nociception. And when nociception, which actually triggers the whole stress response in your body, when that gets to part of your brain called your prefrontal cortex, that's when it signals pain. Now, another very common cause of low back pain is when you have a loss to the normal lumbar curve. So those are probably the two most common causes. What we know is chiropractic adjustments, spinal manipulation is highly effective at getting joints to move properly and function properly. And when you put motion back into those spinal joints, it decreases the pain. It's called the pain gate theory. Now, when it comes to loss of lumbar curve, things like chiropractic biophysics, which is a very specialized form of chiropractic and spine rehab, is very effective in restoring lumbar curves and decreasing low back pain long term versus just short term. In one of the research articles I posted below, it was a study published in Spine, and it was a clinical trial. And what the authors of the study did is they wanted to measure the effectiveness of taking medications versus spinal manipulation or chiropractic adjustments and acupuncture in treating spine-related complaints. And what the conclusion was, the spinal manipulation, the group that got chiropractic adjustments, did far better than both the group that got acupuncture and medications. In fact, when we look at these on a 100-point scale, meaning 100 is the worst pain imaginable and 0 is like no pain, the people that took medications on average only improved about 7 points on pain scales, where those that were getting adjustments improved by 50 points on average. Now, what's interesting, when you read the full article, you will see the people that got chiropractic care were actually the worse off. People that got chiropractic care on average had chronic pain for 8 years or more, and the people that got acupuncture or medications only had pain for about 4 years. And the reason this is very important, the longer you have a complaint, the longer you have chronic pain, generally speaking, the harder it is to get rid of that pain, and it's less likely that treatments are going to be effective. So the people that got chiropractic care actually were the worst patients. They had the worst problems for the longest time, and they still got better results. 27% of the people that got manipulation were 100% asymptomatic after the treatment. Compared to those that got acupuncture, only 9% were asymptomatic, and those that got medications did the worst, and they were only 5% asymptomatic. So we know that NSAIDs, which is unfortunately the most common method used to treat low back pain, is pretty much 100%, almost 100% ineffective. Basically, there's almost no real world benefit. Plus, there are plenty of potential dangerous, harmful side effects of those. We know spinal manipulation has been repeatedly shown, and I just gave one research article today, but it's repeatedly been shown to be the most effective method for treating non-specific chronic spine, non-specific chronic low back pain. So if you're dealing with chronic back pain, or you know someone who's constantly grabbing and taking pills for low back pain, let them know that there's maybe a better option out there. Get them in to see a local chiropractor. If you're in Fort Collins, have them call our office and ask for a free consultation exam to see if there's a natural solution for yours, or if it's someone else you know for their chronic back or spine related pain.